Patricia Beaulieu. She's the RN who has over 40 years experience. Oh my goodness, you're an expert. That's a lot of experience you have behind your belt. So Pat, people have been dying once they go to the emergency room and then leave. How comes? How so?
There is overcrowding in the emergency rooms. Patients flood the emergency rooms. The doctors can't timely get to the patients, or the nurses can't timely get to the patients. So they push some of them out quickly without even finishing looking at the patient and prescribing, and sometimes they don't even talk to the patients.
Oh my. So are you saying that the emergency room is dangerous?
It's very dangerous. It's very, very dangerous.
Oh my goodness. Did you hear that, Dr.
That is something to wonder about.
Nobody would have known that. If you would tell the ordinary person that is going into the emergency room that the emergency room is dangerous, they would not believe you. What do you have to tell them so that you're more believable, so that they believe what you have to say? Why should they believe you?
I've worked in over 63 hospitals in my 40-year history, and the healthcare has deteriorated because now they treat emergency rooms as primary care office.
Oh wow.
They don't go to their doctors for a hangnail. They come to the emergency room. It overcrowds the emergency room, and then things are missed and patients are booted out of the hospital before they even had a chance to have all their treatment given.
Wow. That's not good. That doesn't sound like a good thing. If I'm in the emergency room and I don't feel well and I'm in pain and they tell me to get out, I'm not going to go. I'm not going to want to go. I'm going to say I'm in pain. Don't you get that?
I had a patient, and the doctor said the patient was discharged. He told him to leave. He refused. So he had security usher him out the door, and 2 hours later the family called, "Where is our family member? He has not reached home." And the security guard was finally asked to go and check the grounds, and they found the patient dead in the bushes.
Oh my goodness.
Whoa.
That is not good. That is not good. Is this a regular incident? How can you get sick, go to the emergency room, you get booted out while you're still sick, and then you're found dead in the bushes? That is not making sense. What possibly could have happened to that man? Do you think that he was discharged too early? Why do you think that is happening?
All patients, the majority of patients that don't get admitted are released to go home unsafely. And if the nurse says this patient is unsafe to discharge and refuses to boot the patient out the door, then they have a chance of either getting fired or losing their travel contract or something else.
Okay, so basically you're saying that the staff that works at the hospital, they're powerless. They can't say anything because they're going to get fired if they do. Is that what you're saying?
Well, that's close, but charge nurses particularly are pushing, like the doctors, to get the patients out.
Is there a reason why there's such a push to boot the patient out, so to speak, from the emergency room?
Yes, it's overcrowding, it's underpaying, a lot of homeless people. I was told once to discharge a patient at 3 in the morning who was a known homeless patient with severe respiratory problems.
Okay, so is that a logical reason to boot a patient out of the emergency room, a patient who is still sick, just because, as you just mentioned, overcrowding and underpaying, is that a good enough reason to boot a patient out of the emergency room, a patient who is still sick, a patient who is not ready to go?
It's negligent. And I say this with capital letters. One of my patients, I was told, this homeless man, to kick him out at 3 in the morning.
Oh my God.
His respiratory...
No.
His respiratory rate was in the 50s. He was struggling to breathe, and I refused to push him out.
Oh my God. 50s. Respiratory rate is in the 50s. That means that you're basically gasping for air. You're in distress. And you're saying that he has to leave because of overcrowding or whatever reason? That doesn't even sound or make sense. So, Pat, what do you think the answer is? What do you have to tell the public? We do not want to give you, the audience, the impression that the emergency room is so bad that you should not go to the emergency room. That is not what we're trying to say. But I want Pat, being that she is the expert, being that she is an RN with over 40 years of experience, she's telling you like it is. She's going to tell you the raw truth, and that is what she's been telling you. So in your opinion, what should resolve this problem? What is the resolution? How can we, as a community, rectify this problem? Because it doesn't sound good what we're hearing.
Absolutely, it doesn't sound good.
The nurses have to stop believing everything the doctor says and wants to do, and the medications and all that. They have to stand up for the patient, because the patient is our responsibility, and our responsibility to save their lives.
All right. So basically you're saying that they need to stand up to whoever it is that's ordering these patients out. But you also said that they could lose their job. Their job is at risk, okay? So then that's the dilemma right there.
That is. I've lost, I would say, about 12 contracts in the 40 years as a travel nurse, because I dig my heels in and I refuse to discharge patients who are unsafe.
So the reason you're here is because you want to do something about it, okay? Why would you want to come and say something like this to the public today? Why? What do you want the public to know?
I want the public to know that they take their life in their hands when they go to the hospitals and are treated without anyone laying their hand on them. The doctor doesn't examine them, the nurse doesn't examine them. They just get on the computer and ask questions and fill in the answers.
And what is your motive for being here today? Are you gaining anything from being here today?
No, I am not. And some of the things that I have to say may cause me to lose contracts, but I don't care. I want the patients to be safe, number one. And that's my ultimate goal. Okay, we have come to a close. We are on the Doctorates Talk Show. We hope that today we have increased your awareness about healthcare in your community.